Lesson H1, Health and Violence. In the last lesson, we talked about issues of global wealth, power, and inequality. For this last module, we need to look at a few other major issues facing human society. We talked about the general trend of globalization, increasing connections between different parts of the world in money, power, cultural norms and values, and people themselves through the increased ease of movement and communication. Functionalist modernization theory says that competition in global capitalism will help everyone, as multinational corporations invest for profit in poor countries, allowing them to industrialize their technology and modernize their economy, culture, and politics. Conflict-focused dependency theory points out that because global capitalism grew out of global colonialism, wealthy countries are able to maintain dominance over poor countries through neo-colonialist control of their economy, utilizing resources and manufacturing in an economic world system. While many middle-income countries have competed successfully, and wealthy elites all over the world have benefited, working and middle-class people in post-industrial societies often lose their jobs, while the poorest countries remain stuck and absolute poverty continues to take many lives. The problems of extreme poverty are tied to issues of health. Good health is tied to longer life, greater productivity, and overall happiness and social well-being. Health problems for individuals may have a variety of causes. Communicable diseases such as HIV and malaria are spread from person to person in many different ways. Non-communicable diseases such as heart disease, diabetes, and cancer are related to everything from genetics and lifestyle to environment. Injuries may cause harm as well, whether by accident or intentional violence. Psychological health is also important, and untreated problems may lead to depression, addiction, or suicide. Health is biological, but it is also tied to our social structures. The status of health we assign to individuals changes how we react to their situation, in some cases allowing them a special sick role that relieves them of some of their responsibilities, but also comes with the expectation of getting treatment. Medical diagnosis and care, and the medical institution that provides it, have become a major part of our lives, what some people call the medicalization of society. This can be very helpful in providing help to those in need, but can also be a method of social control, removing some power from individual choice. Why are private health problems considered a public issue to begin with? How do our personal situations, behaviors, affect others around us? One of the most obvious is that of our social behavior affects the spread of disease. Why are rates of sexually transmitted infection higher in some states than in others? Could it have something to do with public knowledge of sex and safe practices? There is no federal requirement for sex education, and state schools vary between in-depth discussions of sexual issues and safety to providing almost no sexual information at all. Some states focus their teaching on abstaining from sexual behavior in the hopes that it would decrease teen sex. But many of those abstinence-focused states correlate with some of the highest spreading of disease. But health problems, including STIs, are related to other factors as well. Poverty correlates strongly with the spread of disease and medical treatment. Social epidemiology is the study of social factors and how health problems are spread, prevented, and treated. It asks questions about cultural norms from hand-washing to condom use, lifestyles and beliefs. How does selection bias and faulty research prevent people from utilizing medical care? It also investigates health differences between different social groups, including why, on average, the poor die younger and women live longer. Social epidemiology also would look at the larger patterns of health as society changes. For instance, since the Industrial Revolution took off in the United States, life expectancies all over have nearly doubled from around 40, a common age of death in pre-industrial societies, to nearly 80 today. Modern science has led to many innovations, including means of providing abundant and reliable food, avoiding the problems of malnutrition. It has also provided us with technologies from antibiotics and vaccines to X-rays and artificial hearts. Modern social structures increase the availability of medical care, in part due to urbanization and easy transportation to hospitals. Other institutions, and our cultural norms and values, have also allowed us to live longer by making us more independent with people outside of our in-groups and giving us more opportunity to compete in nonviolent ways for better lives. And it's not just the United States where life expectancy has increased. All over the world, with only a few exceptions, people are living longer today than they were even a couple generations ago. But where you live still matters, as average life expectancies range between less than 40 in some countries to more than 80 in others. Even Eastern Europe saw a slight drop after the collapse of the Soviet Union. If you want to understand why some people live longer than others, it helps to understand what's killing them. In wealthy, highly industrialized, highly developed countries, non-communicable diseases are the biggest killers, as they are often chronic and difficult to treat, but are more likely as we get older. In poorer regions that are still in the process of modernization, the biggest cause of death is still communicable diseases that cause acute health problems in people of all ages. Many of these diseases are easily preventable or treatable, and lack of education is part of the problem, as is malnutrition, which leaves immune systems vulnerable. But the larger problem is simply getting access to the medical services more privileged groups take for granted. Where you live and how much money you have makes a massive difference to the kind of health care you have access to in many countries. Life expectancy is lower in the United States than in many other wealthy nations. So how are people dying here? The top 4 causes of death are heart disease, cancer, strokes, and breathing issues, all non-communicable diseases. While treatment for those diseases is expensive and doesn't always work, are there larger reasons why so many people suffer from them? While industrialization has led to many health benefits, it also has led to greater levels of carcinogens and toxins in our air, water, and food. Having machines do our work for us has also led to lifestyles that lack in physical exercise, even while we eat more and more fatty, salty, and sugary foods. Overuse of antibiotics, for both livestock and humans, is already leading to superbugs that are far more difficult to treat. Living together and moving easily around the globe also means diseases spread more easily, and increasingly we hear about the threat of global epidemics. While injuries aren't the leading cause of death in this country, fast cars and other massive machines can cause fatal accidents. While violence has tended to go down in industrial societies, increasing inequality may lead to more resentment and role strain, and new weapons give those who do resort to violence far more power to harm others.